People are putting off mammograms and colonoscopies because of the pandemic. Texas doctors say cancer screenings have plummeted since March. That could have a major effect on diagnosis and treatment.
As KXAN investigator Arzo Dost explains, doctors worry about people who are showing no symptoms and may be putting off these screenings.
It's an appointment Kate Peck refuses to miss. Even during a pandemic, she went to her mammogram screening.
Had no pain, had no lumps, had no discharge. There was absolutely nothing.
But the mammogram caught something she might have missed on her own. And just last month, Kate was diagnosed with breast cancer.
If I didn't have my yearly, I don't know how long it would have gone without me knowing it.
And that worries doctors who are seeing screenings drop because of COVID-19 exposure concerns.
This is going to have a ripple effect for the next year or two when cancers are diagnosed at a later stage than if they would have had their routine screening, they would have been diagnosed at an earlier stage.
Dr. Michelle Ashworth with Texas Oncology says mammogram, colonoscopy, and pap smear screenings have dropped by about 90% at their practices across the state.
I'm talking about people who don't have symptoms, people who feel fine, but they just need to keep up their routine health care. My concern is that they're going to be diagnosed at a later stage, and then their cancer is going to be less curable.
Dr. Ashworth says practices have come up with safety guidelines at screenings, which includes wearing masks, no visitors, and spacing out appointments. Staff is also required to wear personal protective equipment and disinfect after screening each patient.
So yeah, we're starting the battle.
Just last week, Kate had a partial mastectomy and started on a radiation and chemo treatment plan. She says her mom died from breast cancer, so even COVID-19 wasn't going to scare her.
I did come home and tell my 30-year-old daughters, get in and get your baseline mammograms. I will preach that.
Arzo Dost, KXAN investigates.
Dr. Ashworth says that the National Cancer Institute also warns that delays in screenings could mean 10,000 more breast and colorectal cancer deaths over the next decade.